Good afternoon, everyone, and welcome to International Forum for Sustainable Asia and Pacific, ISAP 2020, organized by IGS. And we are going to start with the seventh thematic track entitled Waste Management in Response to COVID-19, Exploring Ways of Response and Recovery. For this session, we have Mr. Onagawa, Director of CCET, as a moderator of the session, and we also have a panel of distinguished speakers. From Ministry of Environment, we have Mr. Yoichi Kamiya. From UNEP IETC, we have Mr. Sunichi Honda. From Health, Environment and Climate Action Foundation, Nepal, we have Mr. Mahesh Nakarmi. From Institute of Technology of Bandung, Indonesia, we have Professor Andri. And from CCET IGS, we have Mr. Prem Kumar. The session will start with the presentations by 5 speakers for 10 minutes each, followed by a discussion, 20 minutes, followed by a Q&A, 10 minutes. In overall, the session is for about 90 minutes. And in this session, we encourage all the participants to use Slido for sharing their questions and comments, which helps the session to be more interactive. There is a QR code for Slido on session's webpage, from where you can access it through your smartphone, PC, and tablet. I'd also like to highlight that at the end of our session, we'll be requesting you to respond to 2-minute survey with URL code. Please kindly cooperate with us by providing your feedback on our session, which will help us to improve the future events. Without taking much of your time, I would like to turn my microphone over to Mr. Onagawa, the moderator of the session. Thank you.
Thank you, Rajiv. Welcome to this session on COVID-19 and waste management. COVID-19 pandemic still prevails in the world. According to the latest figures by WHO, daily new cases of COVID-19 hit the highest record on 7th November, Saturday of the last week, just 4 days ago, with a figure of about 610,000 in the world. Among these 610,000 tested positive on 7th November, 54% was reported in Europe, followed by in Americas, North-South America, with 30% and 9% in Southeast Asia region by WHO definition of the regions. We remember the famous Spanish flu was observed in 1918, caused by N1H1 type flu virus, which was 100 years ago. However, SARS, severe acute respiratory syndrome, happened in 2002, MERS, Middle East respiratory syndrome, in 2012, and the COVID-19 this time. All of these SARS, MERS, and COVID-19 are the subspecies of coronavirus. It is noteworthy that coronavirus respiratory syndrome have happened repeatedly in a short period in this century 21st, and we need to be prepared for this virus, which may happen anytime in future again. This COVID-19 is giving an impact on the operation of medical services at hospitals, clinics, and quarantine facilities. Naturally, medical people use PPE, personal protective equipment, to protect themselves from the COVID-19. And these PPE potentially become the source of next infection once they are disposed as waste. The amount of medical waste is expected to increase because of increased use of this PPE and supplies for medical care, which is usually made of plastics or papers. Increased amount of waste itself is a problem already for its collection, treatment, and disposal as waste. However, COVID-19 has a broader impact on our waste management. In many Asian countries, we are relying on landfill for the final disposal of waste. And it is usual that many waste pickers are working at such landfill sites for the collection of valuable materials. Also, this final landfill site may become a source of pollution through the leachate water. The quality of waste management service differs based on the conditions of respective society. Proper treatment of the waste may be possible in cities and big towns, but we are concerned with the condition of its operation in suburbs and remote areas. The impact on the waste management is not limited to this, but also to recycling activities as well. We are promoting the recycles of used materials for the better, efficient use of our limited resources. Recycling of PET bottles, papers, cardboards are examples of this. However, it is reported that the amount of plastics being recycled is rapidly decreasing due to current economic situation under the COVID-19 pandemic. COVID-19 is giving an impact on the world economy, and this situation causes less demand of the materials to be used in their production process, including recycled plastics. Lower oil price adds another reason for the reduced demand of the recycled plastics. Every country is taking actions for this problem based on the conditions of their own countries. Naturally, we are interested in learning the experience of other countries, not only for the quick actions to respond to the current problems, but also to be prepared better for future, including the concept of BBB, Build Back Better scenario. Today, we have invited renowned resource persons for this discussion from the government, international organizations, academia, NGO working for this subject, and also from our center, CCET. I hope we can learn the experiences of respective countries and organizations for the better discussion of this subject, COVID-19 and waste management, and also for better scenario setting for future, both of which are quite common subject for the world. Ladies and gentlemen, participants of this webinar, having said so, I'd like to invite the first speaker, Dr. Shunichi Honda, from our collaborating organization, UNEP International Environment Technology Center, located in Osaka, Japan. He is a program officer for chemicals and waste management at UNEP ITC. So, Dr. Honda, you have the floor.
Thank you, Mr. Onogawa. So let me share my PPT on the screen. So on the 1st January 2020, We, the United Nations Environment Program, were expecting another important year with our big hope. However, one small threat starting destroying our big hope and pushing us in difficult situations. That small threat was growing to a global crisis in a twinkling. UNEP started combining all our efforts together to confront this global crisis, the COVID-19. The UNEP sees three planetary crises: climate change, biodiversity, and pollution, caused by our unsustainable consumption and production. We should have developed our human society within the planetary boundary, and we should not have spent natural capital negatively. Unfortunately, we eventually became aware of the current critical situation after we almost irreversibly created huge impact on our planet. We may not be able to win our new global crisis unless we seriously take our necessary actions for three planetary crises. We should rethink our behavior and redesign our society within the planetary boundary. UNEP sets 4 responses to support member states against the COVID-19 pandemic. Number 1 is medical and humanitarian emergency phase. Number 2 is a transformational change for nature and people. Number 3 is investing to build back better. And number 4 is modernizing global environment governance. Among our 4 responses, there is one common item, which is global waste management. With International Environmental Technology Center of UNEP is the Office for Waste Management in our organizations. We now take rules to combat global waste management issues relating to the COVID-19. After our previous normal became abnormal now, waste management situation seems to be more difficult. It seems that we generate more municipal solid waste and other waste, including medical waste. This is a new crisis on waste management at all the levels. At the initial emerging phase, we did not have time to strategically consider what we should do with those waste. So far, we have been barely treating waste within our capacity. However, we now really need tangible options to manage COVID-19 waste in environmentally sound way, because we can't see the end of this fight. It will go beyond a year and may continue for years. At tentative data in 2019, we had totally generated about 53 billion tons of waste, including about 35 billion tons of industrial waste, about 2.1 billion tons of municipal solid waste, about 0.9 billion tons of hazardous waste, and about 0.8 billion tons of medical waste at global level. Of 2.1 billion tons of municipal solid waste, 50% went to open dumping sites, 27% went to recycling, 15% went to incinerations, 11% went to sanitary landfill sites, 1.2% went to waste-to-energy treatment plant on global average. If you know the other data, you may have some feelings. That data is 93% of municipal solid waste generated from low-income countries went to open dumping sites last year. So you can imagine how worse it is against COVID-19 waste in those countries. Based on this estimated data, there are 2 points that we have to consider about waste management situation affected by the COVID-19 in 2020 and onwards. The first point is, how should we now implement COVID-19 waste management? As an emerging phase like now, whenever possible, countries and cities should control COVID-19 waste through maximizing the use of available waste management solutions. And at the same time, look to avoid any potential long-term impacts on the environment. In the absence of appropriate technology, they need to consider adapting 3S methodologies, namely sorting, segregation, and storage, and installation of temporal and stopgap solutions. The second point is, which kind of environmentally sound technologies should we adopt? We now apply traditional medical waste treatment for COVID-19 waste, but such system was developed only for general medical waste. We did not foresee necessity of pandemic waste management so far, unfortunately. After several months, we have to move to a next phase of COVID-19 waste management. Necessities of environmental sound management and technologies among countries are vary. Low-income countries need simple technology. Lower and upper middle-income countries need technology at the middle level. And high-income countries should use technology at advanced level. This is the same approach for the integrated solid waste management. We have to say now that it is the right moment to find appropriate solutions within national and city management appropriate for their situations against the COVID-19. So everyone needs to redesign our waste management system. A keyword here is redesign of our waste management system. Some countries which are vulnerable to natural disasters may have contingency plan for disaster waste management. But we did not think about any measures against virus pandemic in these countries and in these contingency plans so far. We now need another contingency plans as part of pandemic waste management strategies within an integrated solid waste management. There are mainly 2 lessons learned so far. We have to redesign our current waste management system against the global pandemic like the COVID-19. Our waste management system should be resilient for another case which may be happened, investing to build back better, so to speak. The second one is to rethink our society and lifestyle, which are far beyond the planetary boundary. COVID-19 pandemic forces us to realize that the health of people and the planet are one and the same. The long-term threats of climate change and ecosystem and biodiversity loss also spring from the destruction of nature by us, and then the COVID-19 came. We will continue facing global crisis unless we change our society and our life to more environmentally friendly and with our nature. We should not return to our same society and lifestyle before the COVID-19, and we should be more resilient. So that's all my presentations. Thank you so much, and over to Onogawa-san. Thank you so much.
Thank you very much, Dr. Honda, for about the activities of UNEP as one of international organizations. We have learned that we haven't worked so much for the biology, the infectious waste related waste management so far in international world society. But we know that in respective countries, they are in the position, need to take some actions in response to the current situation. And such situation, we can learn from the members of the participants for this session from Southeast Asia or South Asian world countries. Thank you very much, Honda-san, for your speech. Then next speaker is Mr. Kamiya from the Ministry of Environment of Japan. He is the director of Waste Control Division of the ministry and directly responsible for this subject, COVID-19 and waste management in the ministry. He would introduce the case of one of the most well-prepared cases of waste management, which is what we can see in Japan under the endemic condition. So, Kamiya-san, you have the floor, please.
Thank you very much for your kind introduction. I am Kamiya of the Ministry of the Environment. Today, I would like to discuss Japan's legislative system and measures taken against COVID-19 and the experience of Japan through the pandemic. First, I would like to discuss the system of waste management in Japan. One of the category of the waste is those generated from business activities or industrial waste, and also household waste is being managed by the municipal administration. And industrial waste is classified to 20 different categories and needs to be treated accordingly. Next slide, please. Next slide, please. Now, in terms of the treatment and disposal of industrial waste, those generated the industrial waste will first transport the waste to intermediate treatment facility before final disposal. And disposal is being overseen by the local government. Also, manifesto-based management is the method of industrial waste management. Next slide, please. Hi. Now, let's discuss the process infectious waste have to go through. Infectious waste in Japan is considered as a type of specially controlled waste. Specially controlled waste have different types. For example, those that are explosive, toxic, or infectious in nature. And they face a stricter criteria when it comes to treatment. And also the flow of infectious waste, those coming out from medical institutions or facilities that contain or may contain infectious pathogens are the ones labeled as infectious waste from HEIs. Now, the treatment of infectious waste is carried out based on the treatment manual which was set forth in 2018. Waste needs to be separated and segregated when the waste is put out and transported. And packaging needs to be sealable, and it needs to be sealed in a container that is damage resistant. Treatment standard also stipulates that it needs to be collected and transported in a segregated manner and incinerated and treated in ways that does not cause any spread of infection. Actual process include melting, sterilization, and other measures, including of disinfection. Next slide, please. Now, in order to determine whether the waste is infectious or not, waste coming out of health care institutions may be categorized as infectious waste if the criteria below is met. Blood, serum, blood plasma or body fluid, or pathological waste, say for example ICU, so operation room, is the place of generation of the waste, or 3, waste or the object used for testing, examinations, or other medical procedures. So, with a detailed description of the category of the waste, we are trying to minimize the amount of infectious disease that deserves special treatment. This slide is about the guidelines of measures against new influenza in waste treatment. This guideline was last amended in February 2009. In dealing with the COVID-19, this guideline proved quite useful, especially at the nascent phase. Measures were taken based on the guidelines at the nascent phase of the pandemic. Next slide, please. This is the timeline of COVID-19 treatment measures by Japan. First case in Japan was first identified in January, before the closure of Japanese schools, and the emergency declaration was made on April 7th. Waste disposal related industry players was considered as one of the industry that is essential for the health and safety of the nation, and they were required not to suspend their operations, and the emergency lasted till the 25th of May. This slide lists the measures taken against the spread of COVID-19. In order to contain the spread of the infection, we have created brochures for medical institutions and for households and other entities. And we also have created frequently asked questions list. We also have resorted to any special measures. Also, we also formulated a guideline specifically for the COVID-19. This is one example of the brochure for medical institutions on COVID-19, providing information needed to appropriately treat and deal with the infectious diseases. Basically, it says that the novel coronavirus related waste can be processed in the same manner as you would for other infectious waste. And this is some samples of questions of FAQs. This question is about the need of disinfection, and the answer was that the double bagging can often ensure higher level of safety, meaning that the disinfection is not necessarily mandatory. This is the details of the amendment of regulations of waste management and public cleansing law. Say, for example, special treatment of the infectious waste related to the COVID-19, and also some waivers available under the pandemic were also stipulated. This is my last segment of my presentation on the guidelines for measures against COVID-19 in waste treatment. To summarize, site of generation, be it medical institutions or accommodation facilities, notes that needs to be taken are listed. And the people were required to be mindful of those points. And this slide is the notices and points that needs to be taken into consideration. Also, BCP business continuity plan was encouraged to be formulated. At the very bottom of the slide, you can see the roles to be played by different stakeholders, including waste generator, waste management operator, municipality, government, and prefecture. So COVID-19 related waste treatment has been generally successful in Japan. At the same time, we have to disseminate information, accurate information, and we had to work hard to provide needed information in an accurate manner. Thank you very much for your close attention.
Thank you very much, Kamiya-san, for your presentation or introduction of the case of Japan. It is very much impressive that it looks like that Japan has taken only somewhat administrative the actions. In some other countries, which we will learn from now, we have seen lots of the real ground-based actions were required. But in the case of Japan, it seems that by issuing some additional guidance or some leaflets or government orders or something like, you have not seen serious the problems caused by the COVID-19 this time. So it is very much surprising. At the same time, it is very much interesting to learn for other countries, I think. Okay, thank you very much, Kamiya-san. And as the next speaker, I'd like to invite Mr. Nakarumi, Health, Environment, and Climate Action Foundation based in Nepal. He is the executive director of this NGO. And I've learned that his organization has promoted the use of autoclaves for safe treatment of infectious waste, and most interestingly, not as an donation to hospitals of such the facilities, but based on the self-support principle. So I am really looking forward to learning from the case of your organization onto the real management, actual management of COVID-19 related wastes. So, Mr. Nakarumi, you have the floor, please.
Thank you, Chair. Thank you very much. I'm grateful that IGES, Institute for Global Environment Studies, has invited us to be part of this session, and we would like to share our experiences of the COVID-19 pandemic. So basically, our organization is a not-for-profit organization. We are actually promoting the environmentally safe and climate resilient healthcare facilities in Nepal. And actually, our basic is we are working on the non-burn technology using the. So basically, we have started first our project in 1999 on the using the non-burn technology. Non-burn technology, the not as a treatment technology for the waste management in the hospitals. So it is in 1999. Then after 10 years of our experiences, we have been to the other hospitals, and it's like a decade-long experience in working in many hospitals in Nepal on the non-burn technologies. And we have some experience of working in Nepal, in Bangladesh, in Bhutan, and in Sri Lanka also. So this is our short organization. So this is our COVID response team of our organization, which is comprised of young teams. And actually, when we are talking about the healthcare investment system of the country, I would like to brief you first about it, that we always believe on the 3R or 4R or 5R R principles, where we can, is our main part. So we will try to make all the waste in a segregated in the wards, and we will make them to be a recyclable resource recovery principle. So in that context, we use the autoclave as the non-burn technology, autoclave, microwave. Mostly we use autoclave because microwave is a little bit expensive. And regarding competitive burn technology, we have done a comparative study of the autoclave and incineration, and we see that there are a lot of benefit in autoclave technology, which is due to the less operational cost, and the pollution is very low, resilience is very high. We have done a testing in the 2015 earthquake, where the autoclave system was very much resilient than the other incinerator system. And recycling is very much high, recycling possibility there, and toxicity is very low in autoclaving. So waste reduction is made through the recycling. But whether in incinerator, we are making waste reduction through the burning. So it is totally opposite technology we are taking. This is our main our working modality. So regarding COVID-19, you know that it was started in end of December of 1999 in Wuhan, but in Nepal it must like after 1 month, in the end of January, we started actively working on the COVID response. So if you see this chart, like the first case we have got it is in February, beginning of February. Now till yesterday, in 10 months period, we have 200,000 patients from 1 to 200, almost 200,000 patients is increased, positive cases. So from that, we can see how risky we are in risk, how high risk we are. So in this context, one of our main objective was to do how to do the proper waste management system for the COVID. So in this context, our organization has very much highly encouraged to work with the government of Nepal, and government of Nepal has rely on us to develop such system. So our first intervention, our first collaboration was the evacuation of 175 students, Nepalese students from Wuhan during the very high pandemic situation in Wuhan. The government has decided to bring them to the Nepal. So that was our first waste management action we did, and that was I think that is the very, very encouraging our experiences. So, and that was done in very proper way. And then we have participated in the government's guideline development process for COVID-19. The guideline was developed and implemented. Then third was we are in action with implementation of projects with the government hospitals where COVID-19 patient is treated. I'm going to explain all these activities now. So in this context, you can see this is the slide shows that how we acted. There was we have to go the study because we are doing it first time. What kind of waste comes, how it was the process. We went to work with the airlines, we work with the police, we work with the ambulance, we work with the army, so everyone, the government. So there was no PPE in the beginning. So we have also brought PPE from ourselves to donate the government for this. And we have done this whole exercise as a full-fledged focus on the waste management. So we have done the waste, like you can see in the airport, we have developed the biohazard containers where all the waste has been collected one by one from the airport passenger to these containers, and we make the thoroughly waste management plan, how to manage that. We study thoroughly of this process, and we brought them to the hospitals where there is a non-burn technology has been using in 3 hospitals of the country, and those waste were treated by autoclaves, and we have done the testing of each batch of wastes. We tested the autoclave, whether it's functioning or not. We have done the analysis of the waste compositions, and all this shows that this is possible. And actually, this exercise was a really lesson learning from all of us during this pandemic situation. This is our first exercise, and we did it. Government was very happy with this. So our So our second was our guideline development process, where we developed guideline development. And in this guideline development, so we have taken care of the So in the guideline development process, we have this in the guideline development process, we have in the guideline development process, we have this. We have also taken care of the autoclave and micro non-burn technology. We are promoting the peat. We are leastly developed. Burning is highly discouraged during this guideline also, and we have this. We have worked with the 5 major COVID-19 dedicated hospitals where we are improving their waste management system with their wash and other facilities. So in this context, we have a very good experiences, and we have improving their waste management facilities, designing their waste management centers, and we are improving giving them autoclaves and all the needed cutters, all this technology we are providing them. Regarding what lesson learned we have lesson learned that in the beginning the hospital were chaotic because they don't have, no one has idea about the waste management of the COVID things. So COVID was very much new to everyone everywhere in the world, and so we thought that the level of staff awareness needs to be much higher, and we work on that. And then initially the healthcare waste management were handled in ad hoc basis because they all were panicked. No one wants to go inside the waste area like that. So we have slowly we make it a strong. Strongly we work with the stakeholders, with the hospitals, and like that. And there was very lack of the logistics because there was no autoclave available in the market. So it was all we learned that we have to be do some kind of a storage before any kind of emergencies. And so the PPE were lacking, and also there was a very increase of unnecessary waste, like a lot of PPE, single-use PPE were the problem. And so these are all our lesson learned, and there were action required. And we want to do some recommendations that, like in the policy sector, that healthcare management should be an integral part of the healthcare delivery system and paired equally with the other life-saving aspect of the system. So this is very important. We learn, and this is our recommendation. And our preparedness, healthcare management should be integral part of the hospital preparedness for disaster and emergency, including pandemics. Because pandemic was new, no one knows what type of pandemic was this. So it was confusing. So there was no emergency preparedness in our country. So we are now we are a little bit now a little developed. But in the capacity building side, we should have on-the-job training, We should have the technical training of our regular training part of the hospital system. Professional development should be there, needs to be introduced in the part of the academic courses, because there was no academic courses on the healthcare waste management side. So, and research projects should be done. And investment priorities, like there was no investment done for the waste, especially for waste in the hospitals. Hospital waste is taken as a very low priority thing. So it seems that every hospital should have some investment priority for the waste management, and also there should be environment-friendly technologies should be developed. More technology should be developed. So that is not a no research investment has done in that sector. So in the research side, there should be academic collaboration with academic students on healthcare waste management for new technologies. This is lacking, and also the field organizations, collaboration with field organizations like non-government organizations and private and other organizations should be a part of this research, because in the field, really the NGOs and the other private institutions are working in the field. So we have to really have a research collaboration with these organizations also. So these are our recommendations. And I think I completed my presentation. Thank you very much. I'm sorry for the interruption of my slides. There are some problem with the, yeah.
Thank you very much, Mr. Nakarumi, for your the introduction of the experience which you had worked on in Nepal, and such an real experience or suggestions based on your real experience working for that COVID-19 this time would be a very much interesting point of the discussion. Maybe in the round table we can learn more about your experiences and your perspectives for your future. Thank you very much. So the next speaker is Professor Andy Damanfli, Institute of Technology, Bandung, Indonesia. He is a very much well-known professor on waste management and leading this subject in Asia. He is serving for the discussion on COVID-19 at the Ministry of Environment of Indonesia as an expert, and leading the COVID-19 waste management operation in Indonesia. Indonesia is one of the most seriously affected countries by COVID-19 this time. His experience would be of the interest of all the participants of this session. So, Professor Andy, you have the floor.
Thank you for the time. This slide shows you the types of waste regarding the COVID-19 pandemic. In the left side, this is municipal solid waste, but during the COVID-19, we have considered the waste coming from household.
We're not seeing your slides.
Yeah, particularly for use mask, and also from household waste under surveillance. In the left side, in the right side, this medical waste, we have considered also the medical waste generated from one from referral hospital for COVID-19 patients, and some cities prepare special facilities other than hospital. For example, in Jakarta, one homestay, athlete homestay, used for this special facility. And then when the COVID-19 outbreaks in early March 2020 in Indonesia, the Ministry of Environment and Forestry issue an important circular letters to guide. Okay. Something wrong? Hello?
Yeah, Professor Henry, you forgot to share your slides. Yeah, that's.
Oh, okay.
Yeah.
Okay.
Yeah,
Page 3, please. So I will share again.
Oh, yeah, please. Your slide is not being shared. Yeah.
Okay, this
please.
one. This okay?
Yeah. Now it is okay.
Okay.
Yeah. Thank you.
But I cannot repeat again. Yeah. So page 3, this is when the COVID-19 outbreaks began in early March 2020. The Ministry of Environment and Forestry issued an important circular letters to guide how to handle the infectious waste coming from three sources. First, from healthcare facilities. The second, from household under surveillance. And the third, from household. The most important thing from this circular is how to protect waste workers who collect the waste from households by using their personal protective equipment. The waste workers are very vulnerable to exposure the COVID viruses. Before COVID pandemic, the use of PPE in Indonesia were not being seriously implemented. Some cities anticipated the COVID-19 waste for its municipal solid waste collection worker by tightening the use of PPE. However, some of those waste workers do not belong to local government. Estimated around 300,000 waste workers in Indonesia who work routinely in waste collecting and transporting of waste from household and from non-household. Although the Minister of Environment has already issued the special guidance, many local government has not responded properly to the circular. So the main problem is always the limited budget. Some NGO have been raising funds for the procurement of PPE for waste workers in Indonesia. This slide shows you one of the example for the best practice in the city Indonesia. I think Jakarta is the best example in Indonesia in dealing with waste regarding the COVID-19 pandemic. Because they have highest budget among cities in Indonesia. For example, here, this is for municipal solid waste generated in Jakarta City. So the Jakarta Cleanliness Division prepare some special container located in some community area. And then from that, collected, transported into sub-district container, and finally to the city container. And from there, from this point, the third party, I mean the enterprise for waste treatment, for medical waste treatment, collect this waste, bring it to the their facility, and to respond if the capacity of the third party is not enough. So one of the incineration plan, this is a pilot plan in Jakarta, ready to accept the waste coming from the city. This is also the special case in Jakarta. This is for suspect infectious waste from household. So Jakarta prepare some mobile box motorcycle and 5 box trucks for infectious waste. And then this mobile box motorcycle bring the waste to the transfer point. There are 51 transfer points in 6 sub-districts, and then finally again collected by third party for treated in incineration. According to the data, during pandemic March and April, there are about 131 kilogram of mass waste generated from this source. This is show you the some waste generation, the trend of waste generation. The left side, the medical waste. Yeah, there are some increasing of the generation. For example, from PPA, 68 kilogram in January, and then 500 kilogram in March. And then this is from data from West Java private company. Yeah, in January they treat about 10.5 10,000 kilogram. And then in April 22, they collect 14 14,000 kilogram, increase 1.25, I mean. In municipal solid waste, there are some trend that the decreasing of total domestic waste, yeah, particularly from commercial area, but from household increasing, yeah, about 20% from the usual generation. This is just show you the SOP, standard operation procedure in medical waste management. This is the on-site medical waste treatment, yeah, managed by the hospital normally. And then this is for off-site treatment managed by third party. And then in 2020, the Minister of Health issued the guidance for medical waste handling. There are about 26 items, among other, how to use autoclave, how to burying of infectious waste in a remote area, for example. This is a good, I think, good guidance for people working in medical waste. This is, I will show you the hospital, the facility, Indonesia. And then the most important thing, this is about the capacity. Before COVID, the generation about 294 ton per day, but we estimated increasing during the COVID about 314 ton per day. So we lack the capacity about 68 ton per day. And then the second problem is the distribution of waste processing facility is uneven in Indonesia. This is, for example, this is about the third party that offer the treatment facility only in Sipan city, Sipan province, yeah. This is some central government program to solve the problem, from encouraging every hospital to provide the individual autoclave until the development of medical waste management in 32 locations during 2020 and 2024, included the cooperation with kiln cement industry to treat the waste in respective area. So from my presentation, I will close my presentation, but that the daily waste services should not be disturbed, which will worsen the public health condition. So there is a growing awareness that waste workers are at high risk of being exposed to the virus. So there need to be a joint awareness to pay more attention to waste workers in maintaining their health and safety. The processing capacity of medical waste is actually close to the predicted needs. However, Indonesia needs to strive so that the distribution of waste processing facilities is evenly distributed through all Indonesian islands to treat the medical waste particularly. Thank you very much for your kind attention.
Thank you very much, Professor Andy. You have shared very useful or interesting information based on the real research or based on the real experience you have in the operation of COVID-19 related waste management in Indonesia. Maybe we can come back to those points later at our roundtable discussion to learn more from your data or your the information you have provided. Thank you very much, Professor Andy. So as a last speaker, I'd like to invite Dr. Primakmara He is the deputy of IJCCET, and he is working for the waste management subject for quite a long the time in our center. And he's going to report our center's recent publication on COVID-19 related waste management. So, Kumara, you have the floor.
Thank you, Onagawa-san. Let me share my screen. Okay, thank you very much. It is my pleasure to share the IGS, CCT, and the UNEP new publication of the topic of this session, waste management during the COVID-19 pandemic from response to recovery. Actually, this report in both now in two languages, English and the Japanese, you can find from the CCT IGS website and the UNEP website. So the report is quick actions from the UNEP, ITC and the CCT to this issue, COVID-19 and the waste management. So we review literature and country survey from the 15 countries covering Asia, Africa, and Latin America. Actually, it's include more than 30 researchers and experts from both developing and the developed countries. We are so happy that the Professor Henry was one of them who helped us for this report from the Indonesia. So the reports analyze the policies and the practices in managing healthcare waste. We keep a little bit focus on the healthcare waste management before and during the COVID-19 pandemic. And also the report identified some available options and the technologies for the consideration to sustainable healthcare waste management during the COVID-19 pandemic, and also how to move into redesign the society for the after the COVID-19. So actually, I would like to share a couple of key findings from the reports. I feel like both all the three presentations mainly given by the Japan and also Nepal and Indonesia is quite similar and give more important evidence what we found in our reports, because we found that very similar like other disaster situations, because the resilience is mostly based on the capacities of the people or the cities. So we found the cities or the countries which have inadequate healthcare waste management system, policies, and the practice shown more vulnerable in dealing with the COVID-19 pandemic situation than the cities or the countries who well prepared with their waste management systems. So, of course, like Professor Henry mentioned in Indonesia, so we saw the increase of the healthcare waste generation in many parts of the countries and the cities. Sometimes it's double and triple. It's make them more shock for this increased volumes, how to manage without limited infrastructure and the capacities. And also we found some cities and the countries stop their normal source separation activities, and that results in more on the recycling operations and the practice of the local level. And especially we found like Indonesia shown in many developing countries, informal sector is work in waste management sector than the formal government sector. So these groups are especially women and and the informal groups make more vulnerable because of this situation, both their health situation and also their livelihood matters. So it is one of the main situations we found based on this sudden COVID situation. And we found increase in the insufficient handling of the treatment because the most of collected waste is go to the dump site. Like Dr. Honda mentioned, most of these developing countries based on the open dumping. So all these waste mixed with the municipal waste go to the open dump site. And also we found another interesting finding because most of developing countries, including in Asia, have somehow take policies, regulations, and the legislation to handle healthcare waste before the COVID-19, but their implementation and the enforcement is weak. So that is the main reason that the system was not properly happen in those countries. So even though we have proposed policies, legislation, it is not enough for the countries or the cities to they don't stabilize proper implementation and the enforcement mechanisms. And also we found the interesting finding. I'm so happy that see the Professor Henry's last slides. It show that because there were a lot of disparities between the countries, at the same time within the countries, urban and rural areas having waste collection and the proper treatment facilities. You can see you can see this table from our reports because we found in the, like Henry mentioned, Professor Henry mentioned, in Indonesia, the most of facilities are based in the Western Java, like Western Indonesia, Sumatra and Java, but the other part of Eastern Indonesia and the Central Indonesia have very limited facilities and the capacities to handle the healthcare waste management. So it's look like within the countries also the disparities in these services and also infrastructure that's made the problem in the countries. And then what we learned from these things, so it's need a quick response. At the same time, we need our cities and the countries to well prepared for the future to make the system work better for this kind of sudden situation. So response, we found that it is very important to ensure health and safety measures for the workers and also the other peoples, and also prepare contingency plans and address the issue of informal sector and women and the medium scale businesses. But it is not enough, so they had to at the same time think about how they move forward in the recovery and redesign to make more sustainable healthcare waste management and the resource perspectives like Nepal mentioned. So at the final, what we want to show that the CCT with UNEP ITC and the other international partners, we would like to continue these findings of this report further into the national and the city waste management strategies and the action plans, including principles of our waste hierarchy and the integrated waste management and 3R concept. And at the same time, this healthcare waste management will be integrated into the other international agendas and work with other institute researchers and the expert to make this subject further discussions and how we can provide evidence-based policy dialogue within regional and the global levels. So thank you very much. And you can find these reports from our website, and also most of my figures, almost figures, are coming from the report. So thank you very much.
Okay, thank you very much, Kumara, for your introduction of our current report on COVID-19 and waste management. Now, it is a time for discussion among the panelists, but because of the very much short time they are available, I'd like to directly go into the points of the discussions. So, Rajiv, could you show us the possible points of our discussion? Yes, I have prepared some discussion points among the panelists first. The reason I have raised these questions are I am quite interested in the real actions taken in the respective countries or cities. We have learned quite a lot about the administrative rules or the expectations we will work for this subject, but the not so the much discussions was made except Professor Andy. We couldn't learn what kind of problems you have faced in the enforcement of such new regulations, guidelines, or implementation of the action plans you have prepared for this COVID-19 situation. Among all, I am very much keen to learn from the case of Japan, as I said before, I haven't learned listen any specific follow-up measures or something like just where Japan was successful to publish or to follow up already published the guidelines again as an instruction with the material to work on this COVID-19 issues. And if it is a case, this is really a good example of success stories to work on not only COVID-19 problem this time, but also in any the infection-related the waste management in future. So first, I'd like to ask Mr. Kamiya whether Japan has had any problem in the enforcement or implementation of your plan or your guidelines for this COVID-19 issues. Whether you have any problem or not. That's my question. Thank you.
はい、ありがとうございます。先ほどの
Thank you very much. As I said already, right after this corona outbreak began, what was the route of infection? What is the reproductive number of this infection? Such knowledge was lacking from the people of Japan. Therefore, a lot of in a lot of ways, a lot of businesses did not want to deal with this corona-related waste. They were reluctant. And following the guidelines, these corona-related waste could be managed in the same manner as any waste related to infections. But people were not necessarily accepting that logic. That's what I heard. So we try and raise awareness on a continuous basis. So that could be the challenge that I could point out. And in order to have better communication, we had question and answer sessions. We have prepared posters. We have prepared some briefing opportunities. And this has been a challenge, and we have been working on that. And another thing is about the PPEs to ensure enough PPEs. being available. Together with healthcare facilities, masks and others, PPEs were in short, and different hospital facilities are fighting for those PPEs. Across the world, there weren't enough PPEs, and how to ensure enough amount of PPEs for waste management that needed to have support from the government to procure such necessary PPEs.
We can learn that in Japanese case, you are well prepared for this kind of you are well prepared for this kind of infectious waste management in advance by issuing guidelines and others. And although you had faced some difficulties in the initial phase of the implementation of such guidelines under the real COVID-19 condition, but you have been successful gradually by the educating the people, by having discussions with the people related, and eventually you are successful for getting support, and you could manage this the waste management under the COVID-19 very much successfully. That is quite a big success, I think. Thank you very much for that point. And of course, some kind of a competition, how to get PPEs among the medical people or for the waste management people. That is also a common issue, can be observed in other countries as well. So for the same question, the Professor Andy has prepared a quite interesting information in his presentation slides. And I'd like to request Professor Andy to come back those points again, and please brief us a little bit more about the real difficulties you have faced in the enforcement or implementation of the developed action plans or strategies in Indonesia. May I invite Professor Andy for some additional explanation which had happened in Indonesia in relation to COVID-19, the waste management or the action plans.
Okay, yes, thank you. The most difficult, I think, how to manage the waste coming from city. Yeah, so municipal solid waste. We only can say that because the collection rate is very small, yeah, the first. And then the facility provided by the city is very limited, yeah. For example, the PPA, for example, to collect for the wastewater. This is the most problem in Indonesia, talking about the waste coming from municipal solid waste. Still, we have a problem because some city prepare well, but most of the cities, most of the local government do not prepare well. Yeah, this is the problem. Yeah, but in medical waste, yeah, there are some effort that already been done by the central government, how to increase the capacity of treatment. So yes, the problem is the distribution of the treatment facility. First, every hospital must propose the incineration themselves. So to answer the question of the limited capacity, so the local government, central government has issued that allowing the non-permitted incineration to work. Yeah, there are some hospital, yeah, propose the incineration must be permitted by central government. Yeah, this is for the according to regulation. So facing the problem of COVID-19, so the central government allowing the unpermitted incineration in the hospital to operate. Yeah, this is the first action done by the central government, because before the central government must give the license, the permission, but now you can work with your incineration. Secondly, we encourage the transporter, yeah, to collect the waste coming from other area, because the transporter normally working in the same province. Yeah, the transporter of medical waste. And then the third is, I think, to increase the capacity of third parties, because they are working in the capacity according to the permit, not 100% capacity. Although they already built or developed the capacity beyond the permit. So the central government gives the opportunity to the third party to work beyond the permit capacity. And then the most important thing that also we just build or develop one treatment facility in east of Indonesia, in Makassar. This is the addition this month. Yeah, the third party that operate the central treatment facility. For the remote area, we encourage that each hospital work together. Yeah, each other. Yeah, but also we encourage to use, for example, simple pit on-site burial, because it is permitted by law. Yeah, so we can dump the infectious waste. Yeah, normally each hospital have their own autoclave. Yeah, so first the equipment or the facility that can be treated by autoclave must be done by autoclave. And then, for example, PPE, it is the difficult one, must be buried, yeah, in one simple pit or site burial, yeah, because it is permitted. Yeah, so there are some program that already done by the central government. And then I think I have to say also that to cooperate with cement industry. There are some cement industry in Indonesia, in Sumatra, in Celebes, for example. So the central government try to cooperate with them to increase the capacity of central medical waste treatment. I think that's all my explanation about how to solve the problem of medical waste in Indonesia.
Okay, thank you very much, Professor Andy, for your very valuable additional explanation. I am very much interested in learning the, quite flexible manner of the Indonesian government to utilize the already existing facilities up to the maximum capacity, even beyond the level of permission. That is really a practical and flexible operation against to this COVID-19 issue. And also you had hinted the importance of collaboration with other stakeholders, for example, utilizing cement kiln as a substitute for incineration facilities. That kind of flexible way way of thinking is also an important point to consider the countermeasures for the infectious waste management. Having said so, I'd like to invite Mr. Nakarumi for some additional discussions, which is in the case of Indonesia, Professor Andy had introduced the utilization of incineration facility, newly developed one or beyond the authorized capacity, but still these are related to the incineration facility and its use. But in the case of a small country, or in small towns, villages, it may not be practical to rely on such the technologies for waste management. And your explanation of the use of autoclaves at hospitals or the medical centers and others comes into the possible the scope of the operations. So could you kindly share some of your experience on that point, usage of the autoclaves in hospitals, how it is going on in Nepal, and what kind of an action have been taken in relation to this COVID-19 in Nepal?
Yes, and thank you. So actually, when we talk about the small facilities or bigger facilities, in Nepal, there is no common treatment facility. We have no common treatment facility. We have all the on-site treatment only. So every hospital, every health facility is responsible for their own waste by law. So there is no one, not a third party, there is no third party to take that waste. After treatment only, they will take it. So in that context, every hospital is responsible. So whatever the government guideline, they have to follow it. So initially, as you said, it was a panic because no one knows what type of waste is that. So later we also understood that this is the same as infectious waste with any other like HIV waste or any other infectious waste, blood pathogens, everything as we have to treat like same way. So autoclave was, we thought that autoclave is the best option as available in the country, as available in the hospitals. So in that context, they follow the government thing. Those places where there is no autoclave, we take them to, we request them to put it the natural die-off for certain days before the disposal. So because more than, say, if you put more than 72 hours as a natural die-off, the virus will be gone. So that way, so we have then. So in that way, that was the follow. So that was the procedure we have taken. And so in the rural areas where there is no facility, most of them have a small autoclaves. Small autoclave is available in their facility, but everything will not be possible. So we encourage them to do the natural die-off, like more than 72 hours to put this in the natural die-off situation, and then they can dispose it as with the landfill. So that was our main the concept, and so we followed the natural die-off, leave for natural die-off, and then it goes to that was a part of our guideline. So basically, if you keep these waste in the contain the virus inside the bag, biohazard bag, I think it is not a big problem. It is not going to spread away. So that was our natural die-off is one of the idea we put there, and that was what they follow in the small facilities also. But most of the facilities where they have autoclaves, they do all waste, 100% waste to autoclaving. Whatever comes from the COVID ward, COVID hospitals, it goes to the autoclave and do put the autoclave, and that will go directly to the autoclave and it is disinfect in the autoclave. That's the main thing. So in terms of autoclaves also, there is a biomass autoclave also available where you can do the autoclaving by the small 700 gram of wood planks. You can use it. So there are different type of autoclaves. We are also working on the solar autoclaves. So autoclaves there are different type of autoclaves available at the moment. So one thing that these autoclaves will be validated properly. So we do validation of these autoclaves and we make these autoclaves whether it is really working for the waste or not. So we do a spore testing of these autoclaves and make technically feasible for the treatment. And autoclave is good technology because it is all hospitals, they are using autoclave as a common technology for the sterilization in the central supply and sterilization department in the hospital. So they are familiar with autoclave. So that's why autoclave is easy for them to operate, easy for them to understand, rather than incineration. That's why we discuss incineration. There are very few hospitals have incineration. We have already discouraged the incineration, and there is no incineration available in many of the hospitals now. It replaced by the autoclave.
Okay, thank you very much, Mr. Nakarumi. For the additional explanation about the autoclave application in the case of Nepal. And we have learned that in the case of Nepal, your waste management, in particular for this kind of the infectious waste management, relies on the on-site treatment, while in many other Asian countries like Indonesia or Japan and others, rather relying on the centralized system. So that is because of the different social condition and the technical conditions or the others social conditions, and because of those different conditions, I think. So we're considering the respective social, environmental, economical conditions. We have to consider what would be the best way to use for these among the possible several options of the applicable ways of treatment. Having said so, I have to say that it is already the 4 o'clock in Japan time, which is the time we have to close this session. I was planning to have some question and answers, getting the question from the floors or the participants for this webinar. But I have learned from my colleagues that so far we haven't received the no question. So we received just one question. So let me see. Please allow me to extend our session just by 1 minute or so. How to develop permanent treatment facilities, not only emergency temporary solution. I was passed this question. I'll repeat. How to develop permanent treatment facilities, not only emergency temporary solutions. This might be related to the Mr. Nakarumi's presentation. Do you, Mr. Nakarumi, do you have any comment to this question?
Before developing the permanent solution, we have to do the assessment of the waste inside the hospital or healthcare facility. What kind of waste they generate, what are types of waste they generate, what are the gaps in the waste management system inside the hospital, because every hospital have a different characteristics, different specialty. So waste will also would be different as per the health facilities type. So in that context, after doing the assessment, we will know every information. And based on that, if we design the system for that hospital, then it will be more sustainable and more feasible and more economical. You cannot make a system for all hospitals, same system. We have to develop a system as per the hospital characteristics. Because I have no idea in Japan, but in Nepal, there are 3 ecological regions. 3 ecological regions means there is a high Himalaya, mountain, and Tarai. So if you have a same system, it doesn't work because the people behavior is changing. People have a different behavior. People have a different society, different social values, different habits, different food habits. So different. So in that way, so if we do a assessment, we always do first phase is the assessment, then we do the data analysis, and based on that data, if we design a system for the hospital, then it will be more and when you develop the system, it should be permanent, it should be sustainable, it should be economical, and also the hospital staff should own it. That's most important, because you cannot bring the export the technology, the system from like Japan or from even Nepal to one hospital to another hospital. That's our learning. So we always say, your hospital, we have to design for you. So we design the system for each hospital, and they own it. They own it, and then that's the main way, that is a permanent solution for that. When they own it, the technology they should own, the knowledge they should own, the system they should own, and all this brings together a system which is a permanent solution we found. So we design, we always encourage to design every system in every hospital. That's our permanent solution.
Okay, thank you. Thank you very much, Mr. Nakarumi again. And I will completely agree with your point, that you say everything should not be simply imported from other countries or from other regions, but the best answer for that specific region should be developed based on the real condition of that society, and it should be tailor-made for that the specific regions. And it is already 5 minutes past 4 in Japan time, and I have to apologize that we have to close this session. And as you have experienced, the issue of the waste management is really and endless the discussable the subject, and as and CCET as and Center for the Environmental Technology, but for the time being, with a focus on the waste management in Asian countries, we will continue to work on this subject. And taking this opportunity, I hope we can develop our more close connecting channel between the participants of today's webinar and the members of not only CCETs, but also the participants or speakers for this session as well, including our UNEP ITC or the Indonesia, the Nepal, the experts. And as you can see in the screen, there is an request from the Secretariat to provide us with your the quick observation or comments, suggestions through this QR code. Please access to either Japanese or English QR code, and please provide your any inputs or any comments, any proposals to us through this survey. Thank you very much for your cooperation and also your participation. Very much. Thank you.